Hey everybody, it's Dr. Sierra, and I just wanted to talk to you guys a little bit about pregnancy and chiropractic. If you saw my video it's probably almost been a month ago, I obviously told you guys that I was pregnant. I'm now in my third trimester, and there's numerous benefits to having chiropractic when you're pregnant. Easier, quicker labors, you feel better. Oftentimes we can get sciatica and things like that, and making sure that your pelvis is in the proper alignment. So today, one of the things that I wanted to share with you guys is how to stretch your pelvis, or basically some pregnancy stretches that you can do super quick and easy at home to make sure that you're keeping everything in line, you're stretching that low back so that the ligaments and everything are nice and loose when you're ready to go into labor and so forth. So again, I'm Dr. Leigh Sierra. This video, give me a thumbs up if you're watching. Also, feel free to share this with another pregnant mom out there. I know I was talking to a pregnant lady today, and we actually have the same due date, which is awesome. And one of the things we were saying is we don't have hours and hours to do stretches. There's a lot of videos out there that are available, but one of the big things is sometimes they take an hour. I don't have an hour every day or every night to be doing these stretches. So I wanted to show you guys a shorter version of some of them that can definitely help keep you in alignment and getting ready for your birth. So number one, you need a birth ball, or this is just a yoga exercise ball. You'll notice that I don't have it super inflated. I actually have it so my hips are in line with my legs here. So one of the things is, if you have it super inflated and you're up like this, it's gonna be, one, harder to sit on it. Make sure the ball is on either a yoga mat, or as you can see here, I have it on the rug in my living room. But you wanna make sure that it's not too inflated so you fall off, or so that your hips are not in the proper position. I like to keep my hips at about 90 degrees when I'm on the ball. And the great thing about the ball is you can inflate it to how you like it and how it keeps you comfortable. So in general, when I'm doing stretches, the first thing I always start off with is my spinal home care stretches. So if you're a patient in the office, you know that we talk a lot about making sure that you're doing your at-home rehab and things like that. So when you do those stretches, you can always do the side to side. You can do these right on the ball. If you have a wobble cushion for from Maximize Living that we often give to our patients, you can use your wobble cushion. I find that for pregnancy, I've always liked using the ball a little bit better. I get a little more movement, and it's easier for me to sit on and isn't as uncomfortable on my bottom, if you will. So you can start with this side to side. So one of the things that you should notice is that my hips are actually rocking back and forth when I'm doing this. It's not my entire upper body moving, okay? I wanna make sure that my hips are moving back and forth when I'm doing these stretches. The ball is naturally gonna move when you're doing them, but you wanna get the hips going, because this is how we're gonna loosen up the ligaments that are attached to the pelvis. The other stretch that you can do that's more of the spinal rehab style stretch is the front to back exercises. So I'm gonna turn sideways. So when you're doing the front to back exercises, when you go forward, you're rolling the upper shoulder. So again, we have a lot of weight and compression on the thoracic spine through here, because all the weight on the front of our body. So you wanna roll those shoulders forward, and then when you do the back, you're gonna squeeze your shoulder blades together, but notice how my hips are rocking backwards when I'm doing this exercise. So it's tucking the belly in and rolling the hips under, and then really forcing those hips forward and pushing that belly out. Basically what that's going to do is going to rock the pelvis forward and backward to encourage it to stay in the optimal position, which is with an opening for the baby's head to come out. Also, this is going to feel great on the upper body. So a lot of us lean forward a lot at work. As you know, with me being a chiropractor, I do that all day long. But if you're sitting at a computer, it's the same thing. You're leaning forward all day long, okay? Now, the spinal rehab exercises that we talk about for Maximize Living, we talk a lot about the rotation exercises. You can definitely still do those. Those are more for the spine rather than for the pelvis, which I'm focusing on today. The other thing that you can do is just general opening and rolling of the hips, okay? This, number one, feels really great, okay? So you can roll those hips around in a nice big circle. Make sure you do it both directions. So this feels really good on the pelvis. But the other thing it's doing is, again, loosening up those ligaments. That's the most important thing, especially as we get towards that third trimester and we're about to have the baby. You want to make sure that the ligaments are really loose. So doing these exercises and rolling the hips is great. You can also just do some general stretches, roll the hips to one side, and loosen up the sides here. This is going to stretch the ligaments that are attaching to the top and the sides of the pelvis as well as to the upper parts of your legs. So you can just do those stretches really gently. Now, you guys are pregnant and everything is starting to get looser. So gentle is the most important thing that you're doing. It does not need to be any form of aggressive stretching, okay? The last stretch that I want to show you today is the cat and the cow. So you can do this any different ways. So number one, you can do it on the ball, okay? So I'm just gonna get down here. Sometimes it's much more comfortable as we get larger to do this on the ball. So you'll just lean on the ball and then you're gonna let your belly drop and then you'll arch your back. And you'll let it drop and arch your back. If you don't like doing it on the ball, you can do it on all fours, okay? So that's completely fine, but this is also helping loosen up those ligaments. And you'll just do that a few times, okay? So these stretches that I was just going over with you guys, this is again the quick and easy way to get some extra stretching in for your pelvis. If you're working with a midwife or an OB, I'm sure they're always telling you, do some stretches, do some different things to make sure that you're ready for labor. So I just wanted to show you guys some easy ways to do that. Now, I usually do that for 10 or 15 minutes every night when I'm watching TV at the end of the day. So that way after work, I'm stretching everything out and my body is ready to go. So again, you don't have to make it super complicated. So I'm Dr. Leigh Sierra. I'm a chiropractor in Venice, Florida. If you know someone who's pregnant, share this video with them. Also, you can find me on Facebook, Dr. Leigh Sierra, and you can find me at my website, drleighsierra.com, or on my YouTube channel. Hope you guys are all doing great. And if you're pregnant, I'd love to hear about your birth. And if you have questions about pregnancy and chiropractic, reach right out to me. Have a great night, everybody. Bye-bye.